We're coming into the home stretch. This has been it's been a great day, a great conference. We're so glad that so many of you were able to sort of free up your calendars and schedules and join us here. As I've said many times over the years, our pediatricians and other folks in pediatric practice, we don't get to see each other like we did a generation ago when folks were seeing each other in the hospitals or other sorts of places, even in our own practices sometimes. So it's really great that a big group of us from DC, Maryland, and Virginia can get together under one roof, connect, learn from each other, learn from our specialists, and we hope to sort of keep this going for another couple of decades. And then I can come listen to your retirement speeches. It's like, so I'm glad so many of you returned for cannabis. I mean, cannabis use disorders among adolescents. And I'm pleased to introduce Jean Fletcher, who's a nurse practitioner in our Division of Psychiatry, who has some special expertise to share in this space. So, Jean?
Thank you. All right. Okay. Thank you, everybody. It's so glad. I'm happy to be here today to discuss something that I'm seeing more and more frequently in the clinics. And I wanted to just share some thoughts with you all. I have no disclosures. Okay, so our learning objectives, we just want to review some epidemiology of cannabis use in adolescents. We're going to identify some evidence-based tools to help screen for cannabis use, and then discuss some assessment and treatment for teens with cannabis use disorders. All right, so some epidemiology. Just so you know, cannabis is referring to the products, all products that are derived from the plant Cannabis sativa. And the cannabinoids that include tetrahydrocannabinol is the primary psychoactive compound. And according to the CDC and Monitoring the Future National Survey in 2021, it showed that 30.7% of 12th graders were using cannabis in the past year. And with that, 6.3% reported using cannabis on a daily basis. And that's pretty high. So about a third of our teens are using cannabis. And we know that more frequently, teens are looking at cannabis as it's legal, it's a plant, it's natural. And we know that all may be true, but just because it's legal does not necessarily mean it's safe. So that's some messaging we really need to get across to our teens, particularly as each state, different states have become legalized. We know that more boys are using cannabis than females, but that landscape is actually changing where we're seeing an increase in females as well. So there's some good news, there's some bad news, and then there's some ugly news. The good news is overall, the use of cannabis is actually going down. So that's the good news. However, those that do use cannabis as adolescents are using it more frequently. So that's the bad news. And the ugly news is increase of hospitalizations have surged over the last couple of years. So we're seeing more kids being admitted to the hospital for unintentional overdose. You see little kids getting a hold of someone's edibles and they take more than 1 or 2 or 3 because they think it's candy. That's one problem. Another problem that we're seeing, teens are doing edibles. They may eat brownies. They may not feel the effect and they'll go ahead and eat a couple more. And before they know it, they've hit a point where they're developing a problem and they have to go to the ER to get help. And And let's see, what other unintentional, and then of course, mental health concerns or psychosis is certainly on a surge. So these are some things that we are seeing in real time. So what is going on? Okay, I would say to you, today's marijuana is not yesteryear's marijuana, okay? Back in the 70s, the percent of THC that was in the marijuana was maybe anywhere from 1% to 2%. And now you can see upwards as 20% or higher in the products that they're using. We know that different methods equal different risk. So what are we saying? You know, when I was screening my kids for smoking marijuana, I've just asked about smoking, but they're vaping, they're of course eating edibles, drinking products that have THC in the product. We're also seeing kids using vapes, dabs and oils, which have a higher, greater than 20%, as upwards of 80, 90%. And that can cause a lot of problems. It's difficult to determine the amount of THC that's being consumed. We know that this is not a regulated industry, so this causes a lot of problems as well. And then on top of that, THC negatively impacts the brain development. So when I think about that, I'm thinking about our teens with the prefrontal cortex not developed, that's not fully developed to like 25 years of age. And they're experimenting with products that frankly today is just completely different than it was in the 70s. And that's another message that we have to get across to our parents as well, because a lot of times parents may feel like this is not a problem. They smoked as well when they were 20 years ago, so they don't think cannabis is a big problem, and it very much is different today. So are we asking the right questions? Again, when I would talk to my teens, I would talk to them about if they smoke marijuana. And if they did, I might say, what are you using, paper? Are you flower bud? And that was the extent of my questioning about marijuana. But it's so much more to ask. And this is what I'm learning. Of course, you have your flower bud, you have vape pens. And unfortunately with the vape pens, that's very easy to get a hold of. Again, there's no regulation, so we're not even sure how much THC the person is getting. And it's almost as if it's a comfort measure for some teens, and they can use it throughout the entire day. The products are definitely designed to attract the kids, and that's another problem that we have to face and deal with this industry, because they are definitely targeting our kids. Kids are starting at a younger age, and this is where preventive measures definitely come in. One of the things I like to stress when talking to your teens, you want to build a rapport. A lot of times it's not just going to happen overnight that you get information. Sometimes it takes a little building a rapport. You got to get to know the kid. You definitely want to you don't want to come across judgmental. I'll say this in the other slide, but just say no. That was a slogan in the 80s. I'm aging myself, but just say no was a slogan that just did not work. That campaign was very ineffective. So we don't want to tell our kids, don't do it. It's bad for you. You really want to spend time with your teen. You want to understand what's going on. What are the benefits? How does it help you? And help them to take a look at themselves to see, why am I doing this? Sometimes it's peer pressure, but sometimes it's something else going on. And we definitely want to focus on harm reduction. So some of the questions that I also tend to ask is, what products do you use? Instead of assuming that they're smoking with paper, flower bud, I'll ask, what products are you using? Where do you get your products from? How do you know it's safe? A lot of times they just assume it's safe. They may get their product from a friend and they just feel like that friend is a good friend and they feel safe with that friend. So it helps them to think about it. You know, how do they know their products are safe? I like to ask, when did they last use? That can be very telling. Sometimes it could be the last party they attended, which was maybe a week ago, or maybe it was last night, because it helps them sleep. So it's always good to find out, when did they last use the product? And then I like to ask, did you ever have any bad effects or adverse effects occur? That can also be telling if someone had a bad experience. You know, some may say, I felt a little paranoid, or maybe they didn't have any side effects. So those are just some things that I like to talk about. And then withdrawal symptoms. And one thing I can share with you, most kids do not realize they're having withdrawal symptoms. They don't realize they're experiencing withdrawal symptoms. So that's an opportunity for education. So what are some adverse effects of cannabis? Well, first, we know the short-term adverse effect, you know, there's that sensation of being high, or as teens would say, I feel more relaxed, or I feel happy. So it's always good to ask questions about what are they feeling, what are their benefits. You can have your impaired short-term memory, making it difficult to learn and retain information. This can have an impact in school. Impaired motor coordination, interfering with driving skills. Of course, we don't want our kids on the road getting high and getting on the road. Altered judgment. And in high doses, you can see paranoia and psychosis. Those are the short term. Long term, substance use can develop. I'd rather say substance use as opposed to addiction. And this can occur in 25 to 50% of daily users. So this is something, again, when asking your teens how often are they smoking, this can let you know what level of risk there are. Altered brain development, I mentioned the prefrontal cortex. And the other thing is, when we're working with teens, females particularly, if they're smoking and they're at risk for becoming pregnant, we definitely want to educate them about the risks that are involved. And my coworker, she's not here today, MP Angela Hassler, she actually had a patient yesterday that was pregnant and smoking, and she had no idea the effects on the infant, the fetus. So that was a great moment. And as I like to say, you know, we're planting seeds one patient at a time, because everything doesn't happen all at one time. It's not a quick fix or anything. We just want to spend time with our kids, educate them so that they can make the next best decision. Of course, I didn't mention the physical health concerns, but of course we know that there's lung disease concerns as well as cardiovascular. So those are some things to always keep in mind. Of course, mental health. Teens who use recreationally are 2 to 4 times likely to develop a mental health disorder compared to teens who don't use. And so again, this is another reason why we definitely want to spend time and screen our kids and educate them. And of course, the increased risk of psychosis is as well for long-term effect, as well as diminished life satisfaction and achievement, which is not a good feeling, particularly as our teens get older. All righty. So according to the JAMA Pediatrics in 2021, there were 200,000 youth that were aged 10 to 24 with mood disorders. And it was found that cannabis use disorder is both a common comorbidity and a risk marker for self-harm, unintentional overdoses, resulting in death, and all-cause mortality, including homicide and suicide. So again, this is another excellent reason why we have to continue to work for our teens and help them. And the one thing that has had an impact on me is realizing that substance use disorders is a pediatric problem. So the earlier we can help our kids, the better. And it's a community involvement as well as family involvement, it's community involvement. So when does it become a concern? You basically have a cycle of 4 cycles, basically. You have your tolerance, and this is when a person's reaction to a substance goes down or drug goes down as the person continues to use it. Then you have your withdrawal, and this is when a person stops using and has negative symptoms such as irritability and difficulty sleeping, among others. How many of you have teen patients with difficulty sleeping and irritability? So you have to be able to distinguish, what exactly is going on with my teen. Dependency, this is when the continued physical reliance on a drug or substance despite the negative consequences. So some negative consequences, of course, could be you're not doing well in school, you're not participating in sports like you once used to do. These are all great indicators of something that's happening with the teen, as well as poor grades or not going to school any longer. And then addiction, and as we like to call substance use disorder, and this is a chronic brain disease. It has harmful effects that the drugs have on the person's behavior. There's a preoccupation with obtaining and using the drug and continued use despite the adverse consequences. Okay, so some screening and assessment tools. The CRAFT is well-validated substance screening tool for adolescents ages 12 to 21. It is recommended by the American Academy of Pediatrics and the Bright Future Guidelines for preventive care screenings and well child visits. So it's a very simple screening tool. It does not take long at all. It's very effective. It does include a series of questions that focuses on nicotine use as well as vaping. So this tool has been modified to CRAFT 2.1N. And what I like to add about that, it is evidence-based revision. It's been revised, it's evidence-based that shows the increased sensitivity to the tool. And again, it includes the vaping as well as different methods of administration for marijuana use, including DAPs. So I like that one a lot. This is the tool that we do use at Children's. Now, you have your S2BI and you have your brief screening for tobacco, alcohol, and other drugs. These two have definitely been validated tools as well. They're also quick and effective tools to be utilized in your practice. And it's recommended by NIDA as well. So all 3 of these tools are very effective. We just happen to use the CRAFT. Now, what I like to say about that is with these screening tools, a lot of times we can be in a clinic, it can be a very busy time and you may feel overwhelmed and feel like I don't have time for this. But truly, if you just take a few minutes for the screeners, your management can look like this. I'm sure you all may be familiar with SBIRT, but that's your screening, brief intervention, referral, and treatment. And we know that screening, brief intervention, and motivational interviewing are the most effective first-line strategies in the primary care setting. So you may feel like you do not have time, but when I say brief, it can just be brief. I'm a big fan of follow-up, so I always bring my kids back for follow-up. And, you know, a lot of times they're engaged, they're interested in wanting to know more, particularly when you speak about their brain, they're very interested to know more about that information. And it's something that was really surprising to me because sometimes you think that might be just a little bit boring or over their head. So psychoeducation, just say no. I mentioned just say no back in the 80s. That program wasn't very effective, but now they have a program that's just say no, KNOW. And this is scientifically based preventive program. It's effective in increasing the teens' knowledge and has the potential to affect youth's attitude towards substance use, and it's been well received. So if we just teach our kids what the risks are involved, how it affects their body from head to toe, that can be very informative for the teens. And it's just a way of getting started with the conversation. And again, understanding the motive is very helpful in prevention and intervention. So a lot of times when I talk to my teens and I'm trying to understand what's going on, they're having insomnia, they're not sleeping well at night. And a lot of teens don't sleep well at night. They tend to spend a lot of time on their phones, scrolling through social media, looking at TikTok or whatever. But there are some teens who actually have insomnia for other reasons. And there are times I can share with you, we know that kids who have experienced ACEs or adverse childhood events may, if you experience 4 or more, they're more susceptible to substance use disorders. So there's a lot of things that are occurring with our teens that we have to address and get to the bottom of what exactly is going on. There may be some anxiety, there may be some depression, there may be other reasons why our kids aren't sleeping or they're not able to eat unless they smoke. And there are no FDA-approved medications at this time for treatment, but I do want to mention too, you have your N-acetylcysteine, or NAC. This is over the counter. It is, if you provide 1,200 milligrams, I believe it is, twice a day, this can be very effective in helping with their cravings. So when your teen is considering, like when you do that motivational interviewing and they're actually open to decreasing their use of marijuana, you can help them as they may experience some withdrawal symptoms. And residential treatment is not available for cannabis use disorder unless they have a comorbidity. So briefly, some management of cannabis withdrawal. The potential for withdrawal from cannabis is anywhere from 4 to 50%. And so we have to be able to support our teens if they decide they want to cut back, because we know that withdrawal symptoms can undermine abstinence. The prevalence of withdrawal is higher in users with a history of daily cannabis use. And so we have to help, particularly when you're screening your teens, where they are and how we can support them. Typical symptoms occur anywhere from 24 to 48 hours from stopping the use of cannabis, and the signs and symptoms can include irritability, anger, aggressiveness, nervousness, anxiety, sleep difficulty, decreased appetite, restlessness, and depressed mood. So that's a gamut of some symptoms. We have to address the comorbidities. So if your teen is having some insomnia, you want to talk to them about sleep hygiene and help them get on a better pattern, and we can help provide medications to support them. If you feel like your teen, as you screen them, if they're depressed, you want to address the depression. We know that with depression, gold standard is therapy, but you may have to adapt to that and provide medications if necessary. This is just a graph that I wanted to show you in terms of how soon symptoms can occur and how long they can last. And then it's in your slides. So, but I wanted to show you that, and this is based on a study that was done, Goodwin et al. And then I do have some resources for you all listed here. I have much more resources. I'm sorry, I feel like I flew by this presentation. But at Children's, I'm in the Division of Psychiatry over at Tacoma Theater, and I'm also at the ARC one day a week. And I work with Dr. Kalia Murthy. He's the director of the program. And we are a level 1 ASAM clinic, ASAM standing for American Society of Addiction Medicine. And we provide medication management, and our link is here and how to contact us. There's an excellent psychoeducation for teenagers using cannabis. It's very engaging. It's free. I highly recommend it for any of your teens that you would like to educate on cannabis. And then for parents, we have some resources as well. And then I have my references. And that is it.
1 second. We have time for one question, or we can over there, come to the mic and introduce yourself.
Hi, Brenda Bellamy. The over-the-counter drug you said, what was that?
Okay, it's NAC or N-acetylcysteine. Yep. It's 1,200 milligrams twice a day. Yeah, I should have put that in my slides. Yep. Thank you.